Welcome to Anti-Aging Insights, where age is a state of mind and aging is a treatable condition. And now, here is your host, Dr. Teri Fisher.
Hey there, and welcome to this episode of the podcast. Today we are talking about butt lifts. Yes, gluteal enhancements. And I'm also highlighting a new product that is on the scene. Well, it's an old product, but it's packaged in a new way that has a ton more of hyaluronic acid, which makes it very appropriate for hip enhancement, butt enhancement, areas that typically take a lot of hyaluronic acid filler. Today, I first want to talk about the butt lift or the gluteal enhancement itself. And then I'm going to talk a little bit about the particular product that is making it so much easier for us to do this. Now, there are lots of different procedures out there when it comes to enhancing the gluteal region. A very common one is the Brazilian butt lift, but there are a number of complications with that. It's a surgical procedure, and it's not as easily done simply because there is downtime with the surgical procedure. What is becoming more and more popular is using non-invasive treatments, relatively non-invasive treatments, like a filler to fill the areas of the hips or the butt where somebody wants to have some enhancement. Specifically, this is often done in an area where there are hip dips. So that's just below the hips where the contour of the hip goes in a little bit. A lot of times women will like to have this filled out a little bit so that the contour of the hip is accentuated because it goes in and then it goes out smoothly around the gluteal region without having a hip dip. As well, oftentimes women like to have the butt region enhanced so that it has a little bit of a lift. And this is another thing that can be done through the use of filler. This is not to say that men don't have this done as well. It certainly can be done as well, but it does tend to be more common with women. Now, the way this is done is typically done over a series of treatments because we are dealing with bigger volumes when it comes to enhancing the gluteal region. So you can imagine if you're enhancing someone's lip, oftentimes 1 mil of filler or even half a syringe of filler is more than sufficient to be able to create a nice accentuated lip. However, when it comes to the gluteal region, as you can imagine, it's a much bigger area. And for you to see the results that many people want, you need to be using more volume of filler. What does that mean? Well, it means that we need to use a number of syringes of whatever filler we are using. Oftentimes, this has been Sculptra. And Sculptra is a regenerative type of product that encourages the body to stimulate the production of collagen. And so this, in addition to filling up the area that we're trying to fill up, it actually causes the body to regenerate some of that tissue. More recently, we have been using hyaluronic acid fillers for this as well. This is very exciting because this is the same types of fillers that are used in a face, in a cheek, in a jaw, etc. It's hyaluronic acid filler, and we can simply freeze or numb the area and then inject the hyaluronic acid. Now, as I mentioned, because this involves larger areas, you need more volume. What does that mean in practice? Well, it means that typically the treatment is done over a number of sessions. So in other words, if we are doing a hyaluronic acid treatment for a butt lift, we are looking at doing approximately 100 mils, up to 100 mils per side. And that's in one session. Typically, a person doing this type of treatment would require multiple sessions, approximately 6 to 12 weeks apart. Now, when we do this, we often will use some freezing, as I mentioned, to numb the area. Then we'll use a cannula and we can deposit the filler in certain areas. Now, when we're talking about volumes, just to give you an idea, when we do a cheek, we may do a half a syringe, a half a cc on one side of a cheek, and maybe the other half on the other side of the cheek. Maybe a full syringe if there's a lot of deficit there and we're spacing it out. So that means that we're talking volumes in the neighborhood of 1 to 2 mils to 3 mils to 4 mils if we're doing more parts of the face. And when we're talking about the glutes, we're talking about 100 to 200 mils in one session. Here's where it gets interesting. The way the economics of this work is that it would be very, very cost prohibitive to do that type of procedure using the filler that we typically use on the face, where they are sold by the 1 or 1.2 mil syringes. What's interesting now is that Rev&S, the company that makes filler, Ultra, Contour, and a variety of other ones, they have now come out with a packaged type of filler that is the same as their Revenus Contour that we use on the face, but now they've created Contour XL. This is 10 mils in one syringe. Now we are talking higher volumes, which make it very appropriate for gluteal enhancements. So when we're talking now about 100 cc's per side of a butt lift during one treatment, then we're talking about 10 syringes instead of 100 syringes. And this makes it much more practical. It also brings the cost down and makes the procedure much more practical from a cost perspective. This is really, really exciting. This is a really rewarding and really fun procedure to do as a medical practitioner because the results are instantaneous. We can see the results, and it's very rewarding and very gratifying for the client as well because they see the immediate results as well. Keep in mind, though, that typically it does take a couple of treatments to get to the full result that we're trying to go for, and we don't want to overdo or do too much in one sitting. So that is where we're at with this. Things are always changing when it comes to aesthetics. And I think this is a wonderful development when it comes to gluteal enhancements. Again, because this is relatively non-invasive. It's not completely uninvasive because we are using a needle and a cannula, but it is relatively non-invasive, particularly compared to surgical procedures. And that also means that by and large, there is much less risk as well when doing this type of procedure. One thing that's very important to note about using Revenus Contour for gluteal enhancement is that it is off-label. What that means is that Revenus, the company, has had approval for Contour to be used in the face, but it has not officially had approval for it to be used in the glutes. That doesn't mean it's not safe in the glutes. It just means they haven't done the research study to specifically target that particular area. And so while the indication, the official indication for the Contour XL is still for the face, it is being used in various different areas by multiple practitioners. This is not uncommon. And I just want you to know that, however, that technically speaking, it's an off-label use of the filler in this type of packaging of the XR syringe. So if you're interested in checking that out, feel free to get in touch with me. I'm always happy to discuss any of the treatments that I talk about on this platform. You can always look me up on my website or on Instagram at Dr. Teri Fisher. I hope you have a wonderful week, and I'll talk to you very soon.
Thanks for listening to today's episode of Anti-Aging Insights. Stay tuned to discover more of the latest news, treatments, technologies, and developments in non-surgical cosmetic and anti-aging medicine. For more inspiration, to access the show notes, or to book an appointment with Dr. Fisher, Dr. Frame, or any of the other anti-aging professionals, please visit our website at antiagingvancouver.com. Until next time, stay inspired and live life well.